Hello and welcome to my website. This is Maria Williams, and I've decided to record this presentation that I typically do at seminars and on Zoom so you can watch it at your leisure. This is how Medicare works. And what I'll go over is I'll go over just general information about Medicare, the history of it and how it started, the Medicare parts and plans, and that you have to know the difference of the parts and the plans. You get confused if you don't right off the bat. And then your Medicare options and when to enroll in Medicare. If you've been to one of my seminars, then you have seen this Lyndon Baines Johnson bobblehead. I walk around with it as a visual to let people know that Medicare is based on the law. That's one of the reasons why it's a little bit complicated. It's confusing because people make it confusing because they're selling you something, but it's complicated because it's based on the law. So here are the references if you want to look it up, where to find it. Title 18 of the Social Security Act, and then the Code of Federal Regulations, Title 42. You won't be able to print all that out. It's too much information. One of the things that you'll start getting when you enroll in Medicare is you'll get a Medicare New book, and that book is put out by CMS. Centers for Medicare and Medicaid Services. They are a part of the government that manages Medicare and Medicaid. But when you sign up for Medicare, you'll go through the Social Security offices to sign up. Why? Because a lot of it's based on if you've paid into Social Security taxes to be able to get portions of Medicare. So you can see at the last bullet point here that it's a very, very large program. Over 65 million people are on Medicare. So that's why it's a little bit complicated, because you have a lot of people to service with this program. The first thing up is to recognize the parts of Medicare. So everybody says Part A, B, C, and you think it's going to be so easy, and then you start looking at it and it's complicated again. Because these parts are parts of that law. So when a Medicare was originally put into law back in 1965 with Lyndon Baines Johnson signing it, you saw the picture of that on the last slide, there were only two parts. There was Part A and Part B. And I've kind of color-coded these parts, and you'll see it throughout. Where Part A, I've color-coded it red because that's your hospital insurance. If you're using Part A, you're in the hospital. Part B is your medical insurance. I've just color coded that B for blue. So those are the only two parts that we had in 1965. Then in 1992, Medicare supplement insurance was added as a supplement to original Medicare. And then in 1999, Part C, or Medicare Advantage, was added. If you look in the law, it's still called Medicare Plus Choice because it's a choice. It's a choice for you to get Part C, and Part C is pretty much what people are selling you when you're being sold to, when you're getting the phone calls. And then in 2006, prescription drugs, Part D was added. I'm going to spend quite a few minutes on this slide because it will help you understand how Medicare really does work. I think when people are explaining it to you, they leave out missing pieces. So then you really don't understand the total process. So, created this model to help people understand what's happening. So, first of all, it's really colorful because I think that helps people kind of put a picture in your mind. So the first thing I tell people when I'm explaining this, and I go around with a big board to explain it, and I write on the board. That's the teacher in me. So is that there are two options with Medicare. You have option 1, which is original Medicare plus adding Part D plan, Medicare supplement, and dental, vision, hearing. And then you have option 2, which is Medicare Advantage. I tell people, do not go directly to option 2 without understanding option 1. A lot of people won't even tell you about option 1. They'll just immediately sell you an option 2. There's nothing wrong with Medicare Advantage. It's just that you need to understand it's an option. So let's talk about option one. Option one is original Medicare. We've talked about that in the previous slide, which is Part A, hospitalization. Part B, that's your medical insurance, medical and outpatient. Part A and Part B is called original Medicare because originally that's all there was. It covers a lot of things, but it doesn't cover everything. There are gaps. And so we'll talk about those gaps when we get to some of the other slides, but just know, doesn't cover everything. So one of the things it doesn't cover is your prescription drugs. So you see where it says Part D. Part D is prescription drugs that you need to add in order to be able to get your prescription drugs. And then also for option one, in order to cover some of those gaps of Part A and Part B, you add a Medicare supplement insurance. And then if you want dental, vision, hearing, that's another policy. So the Part D, Medigap insurance, dental, vision, hearing, separate insurance policies that come from insurance companies. Original Medicare, Part A and Part B, that's your red, white, and blue cards that you get from the government. Okay, we're going to talk about the specifics of those and what it costs you, but I'm going to tell you it will cost you, right? So what I tell people is, first with option one, figure out how much each of those are going to cost. I mean, every one of them, whether you think you want it or not. How much is it going to cost you per month? You add that up and then you say, one, can I afford it? That's number one. If you can't afford it, then you can't afford it. But number two is, do I want to spend it even if I can't afford it? Why do I say that? Because you have another option. You have option two. Option two is Medicare Advantage, Part C, MAPD. You'll hear it called a lot of different things. And what Medicare Advantage is just pretend like that yellow box is a bucket. And I made it yellow because I want people to go into Medicare Advantage with their eyes wide open to know exactly what's happening here. So pretend like that is a bucket. And in that bucket, you have put your Part A, hospital insurance, your Part B, your doctors and your outpatient services. And then typically with Medicare Advantage, they may add your prescription drug coverage, dental, vision, hearing, and some other bells and whistles. Right? Probably won't be as many bells and whistles in 2025. And then I'll explain that a little bit later if you come to one of my Zoom classes. But it's a package. It is a package of services all bundled into one, right? And I'll talk to you a little bit about the cost of each of these, but option two is not as expensive as option one. So it looks more affordable. However, you need to get into the details of it where it may not cost you a lot or anything for the premium, the cost per month for a Medicare Advantage plan, but it'll cost you as you use the services and co-pays and co-insurance, right? And also there's some restrictions, like you have to be restricted to a network of doctors and hospitals. And there may be pre-authorizations for different types of services. So there are pluses and minuses to Medicare Advantage plans. You need to understand that and make that calculation. So the missing piece of this Medicare puzzle is that green arrow. And the reason I put it there is because as I was studying this and trying to kind of get my hands around how to depict it for people, the green arrow is the how and the why there is an option two, and it's affordable for people as far as the premium, is because the government is outsourcing their Medicare obligations to private insurance companies. What do I mean by that? So when you look at just Part A and Part B, just the original Medicare, for Part B, when you use the services of Part B, you go to the doctor, you have outpatients, services, the government pays 80% of the costs, and you as the beneficiary pay 20% of the cost. And we as beneficiaries think, 20%, that's going to be a lot of money depending on what it is. But think about for the government. It's 80% for 65 million people. So the government is saying, well, I'm going to outsource my obligation to an insurance company for a fixed dollar amount, so I cap my cost, right? And then you got to think, well, why would the insurance company want that? Why would the insurance company take on that risk? Because that's what insurance is. It's just transferring risk. So why would the insurance company take on that risk? Because there are 65 million people who are potential consumers and customers, and they're 10 million a day turning 65. So it's a business. And you need to understand that. And from the aspect of you as a beneficiary, you need to do what's right for you. What's right for your neighbor, what's right for your cousin or your sister may not be right for you. This is very customizable. And so this is something where you want to talk with someone who is going to get your personal information to be able to put it in a system to say, here are the prescription drugs that you take, here are the doctors that you see, here are all of your options, and here's what it's going to cost to make an informed decision. Is it complicated? Yes. But can you understand it enough to make an informed decision? Yes. So like I said, the previous slide was going to be the longest slide of this PowerPoint deck. What this is I'm going to go through each of the parts, and this is Part A, hospital insurance. You only need to know about Part A if you're under Option 1. If you're on Option 2, Medicare Advantage, this does not typically apply. So Option 1, if you go into the hospital if you just have your red, white, and blue card, the deductible the moment you walk into the hospital that first day is $1,632 in 2024, right? That's what you would immediately spend for your deductible for the first 60 days. If you stay in the hospital after the 60 days, it's $408 a day. You stay in the hospital more than 90 days, it's $116 per day. And you can see why you might need a Medicare supplement, because those could start to add up, right? And then also Part A covers skilled nursing facility. The first 20 days, no charge. 21st day to the 100th days is $204 a day. So what is the cost? What does it cost you to have Part A when you sign up? Typically nothing, because you've already paid for it. If you or your spouse worked for 10 years or more, you've already paid it in your payroll taxes. Now, if you haven't worked 10 years or 40 quarters, then Part A is not premium free. You would have to pay for that. Part B. Part B is for your medical insurance. So that's going to cover your outpatient care and your doctor services. It's also going to cover durable medical equipment and your Part B drugs. Part B drugs are drugs that you're going to get in the doctor's office, like chemotherapy. So most people will pay a premium for Part B. What do I mean by that, most people? Because in 2024, the premium amount is $174.70 for most. However, some people will pay more. It is really depending upon your income. If you're higher income, you're going to pay more. And there's some people who are going to pay less. If you're lower income, there's a Medicare savings program that you can be a part of. But most people are going to pay the $174.70. And you will pay this monthly premium for Part B, whether you're on Option 1, Original Medicare with the supplement, or Option 2, Medicare Advantage. With Part B, there is an annual deductible of $240. And the big thing for Part B, the reason why you need to find a way to supplement or reduce your risk here, is that the co-insurance, the part that you pay, is 20%. The part the government pays is 80%, but that 20% can add up pretty quickly. So that's the reason why you need to figure out a way to cover that cost. So this is Part C. This is Medicare Advantage. So this is Option 2. This is Option 2, where it's an alternative to Original Medicare. Just understand that when you have a Medicare Advantage plan, you are not on Original Medicare. You can put your red, white, and blue card in your file cabinet. You will not need it. for going to the doctor or the hospital. You will show them your whatever company ABC card, and that's what you'll be using. It's pretty much like employer coverage. That's the way, people understand it, is that what you're used to with employer coverage, with a network of doctors. You may have a deductible. You will have copays and coinsurance. You do have something called a maximum out-of-pocket yearly limit. So that's a good thing, because when you just have original Medicare, that Part B 20% goes on and on and on and on. But here with Medicare Advantage plans, there's a cap on it. It could be $4,000, $5,000, and that's how much you're going to spend for the year. But I tell people to understand, you may have to spend that for the year, right? So the other thing to know is that you cannot have a Medicare Advantage plan and a Medigap plan. You can't have that. You cannot have a Medicare Advantage plan and a standalone Part D plan, right? So I've had situations where people have a Medicare Advantage plan and then they make this mistake and talk to someone on the phone and they sign them up for a Part D plan, and that cancels out your Medicare Advantage plan. So you have to be super careful, and I want people to just kind of know that this is health insurance. This is about medical care. So you can, be what I consider bamboozled with, the bells and the whistles that don't have much to do with if you really got sick and needed coverage for health care. So what I want people to do is just focus on that first, and then the extras, whatever they are, those are the extras. Part D, this is for your prescription drug coverage. So with Part D plans, you can get your prescription drugs in two ways. You can get it with a standalone prescription drug plan, so that accompanies option 1 with your original Medicare Supplement, and Part D plan, or you can get it embedded in a Medicare Advantage plan. So with these plans, they are complicated on how they work, because each insurance company is going to put your particular drugs, either they're going to be on their list, it's called a formulary, but it's just a list of drugs, and it's going to be on the list in a different tier or level, and based upon that tier or level, it's going to tell you an estimate of how much your copay is going to be for that drug each month. So these plans come with a monthly premium. If you have a standalone plan, it's going to be a monthly premium. And in 2025, we're going to watch this, because some of the things that have happened with the Inflation Reduction Act may increase the cost of these premiums for these Part D plans. And with these plans, you might think, I don't have many prescriptions, or I don't need prescription drug coverage, and I've run into people like this. They don't get a Part D plan. They have original Medicare and that's all they have, or they have original Medicare and a Medicare supplement without a Part D plan. Mistake. The reason why it's a mistake is because you cannot go 63 days or more without credible drug coverage when you have Medicare without getting a penalty. A 1% per month penalty. Each month you go without a prescription drug plan, they will add that 1% based on the national benchmark premium, which changes every year, to your premium whenever you do get that drug plan. So there are people that don't have the drug plan for 10 years, right? So that's 120%. 12% a year times 10 years of the prescription drug plan premium, then it becomes unaffordable. So just know, don't make that mistake. Don't make that mistake of not having a prescription drug plan, either in a Medicare Advantage plan or a standalone plan. I want to bring up the How Medicare Works model again to make the point of Part B and Part D. There are little asterisks there. And I just mentioned in the Part D slide that there could be penalties if you don't get it. or don't get it in time. There's also penalties on Part B if you don't get it. So remember, Part B costs $174, let's say $175 in 2024. So some people think, I'm not going to get it. They have some other insurance over here somewhere and they don't get it. It could be federal insurance. They don't get it. It could be VA insurance. They don't get Part B. They don't have to, right? But then when you decide you want to get Part B, then you're going to face a penalty for not getting Part B in time. And what is that penalty? That penalty is 10% a year. So that could also add up. So just know that there are repercussions for not signing up for things when you're supposed to. So you do need to know the law of when you need to enroll. A Medicare supplement plans or Medigap plans, all the same thing. MedSup, Medicare supplement, Medigap plans, they're all the same things. These are plans that are offered by private insurance companies. And if you see at the top, it says A through N. The plans are standardized across the country in letters. 10 different plans. So the A through N are the standardized plans. And then going down the side of the chart, you see 1 through 9. Those are the gaps of Part A and Part B. And then in the middle of the chart, it's how much each plan covers those gaps. Right now in 2024, most people will look at Plan G's because it covers most of the gaps. Or Plan N's because it's a hybrid of covering the gaps but also having a little bit of copays. So what I usually quote people is I quote them a Plan G and a Plan N, and we talk about them, and you can make a decision between those two plans. Also, the thing to know is that with these plans, you must always and continue to pay your Part B premiums, and that whatever these plans, whatever you're quoted in the beginning, it's not where it's going to stay. It's going to increase for inflation, and it may increase for your age. So just know it'll start at one premium per month, and then it'll increase over the years. So at some point, you have to make a decision on which option you're going to start with. Option 1, original Medicare with a prescription drug plan and a Medigap plan. And with option 1, it has pros and cons, just like option 2 does. And mostly the pros outweigh the cons. You have Medicare stays your primary insurance, and you don't have any networks on that. You have little managed care and prior authorizations. The cons are really financial, where you have to pay 3 premiums: Part B, plus your drug plan, plus your Medigap plan, and maybe even a dental vision hearing plan. For option 2, your Medicare Advantage plan, this is, like I said, similar to employer coverage, where you are in a network, it's managed care, you have prior authorizations, you pay copays and coinsurance. Those are the cons. The pros is that you're only paying your Part B premium. Most of these plans have low or $0 costs. It's going to include your Part D drug plan, which is probably going to be pretty significant advantage for you in 2025. And then it adds those extra benefits like dental vision, over the counter, and being able to go to the gym. Don't let those extra benefits blind you, though. Just know that they're extra. And then you have that out-of-pocket maximum, which is important. Now, here are your enrollment periods. The reason why this is important is you don't want to miss it. You don't want to get penalized. So the initial enrollment period, when you initially can sign up for Parts A and Part B, is when you turn 65. So when you turn 65, you can sign up 3 months before you're 65. You can sign up when you're 65, that month you're 65, 3 months after you're 65. So they give you 7 months to sign up. Let's say you missed that for whatever reason. Then you have to wait for the general enrollment period, which is January 1st to March 31st. So remember, you missed your initial enrollment period. There may be a penalty here, right? Because you've missed it. This is a big thing that people don't know, is number 3, the Medigap open enrollment, that Medicare supplement. You have 6 months after you get Part B and you're 65 years or older, to enroll in a Medicare supplement plan without the insurance company asking you any medical questions, or what they call underwriting. After that 6 months, they can ask you, and they will ask you medical questions, and you may not be able to get a Medigap plan. That's why I tell people, look at option 1, understand it, ask 100 questions if you have to about it before you just go directly to a Medicare Advantage plan, because you may not be able to come back and get a Medicare supplement plan. So why is this important? Because you can start with a Medicare supplement plan and you may have it for 5 years. And in the 5-year period, you're like, oh, I can't afford this. I need to go to one of those very cheap plans and, not having to pay all this money per month. And you go to a Medicare Advantage plan. Well, you can do that right now in 2024. The law may change. You can do that for a trial of 1 year. You can try the Medicare Advantage plan. If you don't like it, then you can go right back to the Medicare supplement plan that you had before. So that's important. You wouldn't be able to do that if you didn't have the Medicare supplement plan in the beginning. And then there's another enrollment period that you're probably very aware of if you've been on Medicare for a while, and that's the annual enrollment period. It's October 15th and December 7th. That's when all of the commercials, all of the phone calls come. This is when you can join, switch, or drop a Medicare Advantage plan or prescription drug plan. And if you're in a Medicare Advantage plan or prescription drug plan, you need to be working with someone to help you make sure the plan you're in this year is the plan you need to be in next year. And this year in 2024, it's more important than ever. There's so many changes that happen this year for next year that are going to impact people that may not have an agent that is looking out for their best interest. So just know that if you're in a Medicare Advantage plan or prescription drug plan, you need to be reaching out so that someone can help you. And then there's a special enrollment period. So those are reasons like you lost employer coverage or you're moving out of state where you can make some changes to your plans. And then we talked a little bit about the Part B medical insurance, where you have to enroll 8 months after you're losing employer coverage. So a lot of people work past 65 and then they sign up for Medicare at 66, 67. They, retire. They have 8 months from the time they leave that employment to get Part B without a late enrollment penalty. And then for the prescription drug plan, they don't give you as long. You have 3 months to enroll after receiving Parts A or B, or there's a late enrollment period, unless you have credible prescription coverage. So let me talk about that for a minute. Credible prescription coverage is also one of those things that is being impacted because the employer plans typically are credible coverage, which all that means is it's at least as good as Medicare prescription drug coverage. But things are happening where maybe not all employer plans will be considered credible prescription coverage. So there may be many people who are working past 65 may be impacted by some of the laws that are happening. So if you're talking with someone, they call you up or they come and see you or however, and they're trying to quote unquote sell you a Medicare Advantage plan, enroll you in a plan, then if they're not asking you these 3 things, or you don't understand these 3 things, you're not talking about these 3 things, medical providers, making sure they're covered in the plan, your prescription drugs, making sure they're covered and how they're covered and how much they're going to estimate to be costing you each month, and then how much Part B drugs cost in this plan, what's the percentage, and then understanding your overall cost. Like, is there a deductible? Well, what do I pay if I go to a specialist? What is the coinsurance on getting my knee surgery that I need? What is that maximum out-of-pocket number? If you are not having those discussions, then just know that the person that you're talking to is not in it 100% for you and looking out for you. This is too important not to get it right for yourself, to make sure you're in the right plan for the next year, you understand your cost, you understand your risk. Keep asking questions until you do. What I tell people is the person who is sitting in front of you, they know more than you do. Tell them that. This is the purchaser in me. I was a purchasing manager for many years. Say to them, you know what? I don't know everything I need to know right now, but I know you do. So I may be asking you some questions. They may be some stupid questions, but I just want to make sure I have a good understanding. That makes that person feel like they know a lot, and they're going to want to share it with you. And you want to keep asking questions, because some things they may not say because they're trying to hold back for their own benefits, which is not helping you at all. So keep asking questions until you feel confident that you've asked all your questions, you understand what you're doing and what you're getting into, because this is about not only your health, but your finances. This is another enrollment period. This is the Medicare Advantage open enrollment period, January 1st to March 31st. I call this the do-over. I call it the do-over because this is the October, November, December. If you didn't do anything, or you did the wrong thing and got into a plan that wasn't really the right plan for you, and you figured that out January or February or March, you get one chance, if you're already in a Medicare Advantage plan, to switch to another plan. To drop your Medicare Advantage plan and go right back to original Medicare and join a prescription drug plan. What this period is not for joining a Medicare Advantage plan. If you're not in a Medicare Advantage plan, you can't join one at that time. You needed to do that in October, November, and December. So we covered a lot of ground in a short period of time. General information about Medicare, how it started in 1965 with Lyndon Baines Johnson signing it into law, and that it's health insurance for those 65 and older. And then if you're with a disability under 65, you also can get Medicare. We talked about the parts of Medicare. The parts of Medicare are parts of a law, parts A, B, C, and D. And then the plans of Medicare. The plans are things that you get from an insurance company. You get Medicare Advantage insurance plans. You get Medicare supplement plans. And then we talked about your Medicare options. Option 1, original Medicare with a Part D plan and a Medicare supplement and dental, vision, hearing. And then option 2, a Medicare Advantage plan. We talked about the enrollment dates, your initial enrollment period, when you should sign up within that 7 months when you turn 65. The open enrollment period, the January through March, if you missed your initial enrollment period. Special enrollment periods, if you move, if there's a disaster, there's a special enrollment period. And then AEP, that October to December time when you can sign up to join a Medicare Advantage plan, switch your plans, or disenroll from a plan. We're here to help. If you don't already have an agent or someone that you're working with helping you, then please give us a call. You can reach me at 757-933-3688, or you can email me at maria@itkinsurance.com, and I'll help you. I'll sit down with you and we'll go over to your 2 options. We'll figure out where you are right now, what's your next step, what you need to do, and search for the insurance carrier plan that's right for you. Thank you so much for listening and learning, and I hope that this helped you have a basic understanding of how Medicare works. Again, my name is Maria Williams. I'm a health insurance agent and educator, and I'm happy to help you. Just give me a call if I can. Thanks a lot, and have a great day.